You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And according to my first guest, he says that nobody should be wearing a loose-fitting denture. Today's topic, getting new teeth with dental implants. With us, we have Dr. Patrick Loftus. Dr. Loftus, welcome to the program.
Thanks, glad to be here.
Now, I know you brought a stack of photos, so we're going to try to get to as many of those as possible. Now, for people that don't know your dental implant centers, like who's the typical dental implant patient?
So there's really two types of people that we're seeing for dental implants.
All right.
The first are people that have broken, loose, infected teeth, infected gums, gums that bleed, and they brush their teeth, they've been going to the dentist, they have problem after problem each time they go, and they're really scared of being needed to be put in a denture. For those people, we're removing teeth, cleaning up the gums, cleaning up infection, and we're giving them a new set of upper and lower teeth.
Is that right?
Day. Yeah.
And who's the second group?
The second group of people are people that are already in a denture. They've gone through that whole process, and then they were given a solution of something that they can't wear, something that's uncomfortable, they can't eat the foods they want to eat.
You don't like dentures?
You know, I don't like dentures because I see person after person that comes in that I talk to, that I actually meet around town in real life that have dentures. And I've never heard someone say, man, I'm so glad that I ended up here in my denture. They're really looking for something that is different than a denture. And for those people wearing dentures, they just can't really eat very well. They can't eat the things they want to eat.
All right.
And they come into the office, they're able to have a new set of teeth that are given to them that don't come in and out, and they leave with those teeth that day.
You told me, correct me if I'm wrong, that on the day of the procedure for a denture wearer, they walk in with no teeth and they walk out that day with upper and lower teeth that don't come out.
That's right.
Is that right?
It is. Yeah.
And I'll put you on the spot on this one too. If you, let's say it's a Monday and you had availability in the schedule, somebody comes in like this, maybe even they have teeth have to be removed. You say on Friday they could have their new teeth.
Let me give you an example from this week.
Okay.
So this week we had this super nice guy come in who his daughter is getting married at the end of the month. And he's waited up till now. We were talking about, hey, why'd you wait this long? You've got a lot of time before they get married. He says, man, it just flew by. This whole wedding prep season just flew by.
Okay.
And I need some teeth for the wedding. I know it's last minute. We saw him Monday for his consultation, and we had surgery Wednesday. He left with teeth, brand new upper and lower teeth that day. He was only wearing a denture that didn't fit. One denture. He couldn't even wear the lower denture. He was only wearing the upper denture to smile with. He had to hold it in with his tongue when he talked.
So he wanted to smile at the wedding.
He wanted to smile. He wanted to eat. He wanted to be himself. And really, we were able to give that to him. He was able to pursue that and get that for himself by getting upper and lower teeth on
So it's
implants.
a fast turnaround time.
It is. Because of kind of some key reasons that maybe we can go into.
Yeah. Correct me if I'm wrong on this one. The way dental implants are typically done is you go to one doctor's office where they do the dental implants, then you go to another office where they put the teeth on top, and somewhere else to maintain them. At your office, you do all three parts. Is that why you do it so quickly?
It is. Really, that's one of the main reasons why. It used to be that there was only kind of one way to do this, which is you had to see multiple different offices, multiple different specialists. You had to see a lot of people.
It's still being done that way, right?
In a lot of ways it is. The probably majority still do it that way. We've elected not to because of a lot of the technology we can implement, and I want to talk about that specifically. Okay. So, when someone comes into the office, we are able to go through a full evaluation and basically recreate them digitally. And not only them, we can look exactly what a great smile would look like
on the computer, you're
able
to design it. Okay.
We're designing the whole thing, see what their smile is, see what the connections of the implants and teeth would be. We can plan what this person would look like with their smile, with this technology. So all that we have to do is implement it. We have 3D printers, CBCT
you print
scans.
The teeth, like you print the teeth right
there?
We do,
right there in the office.
And that's not how it's normally done.
With a really strong ceramic resin. This is really latest technology that previously they didn't even have access to. And so it's something that's really changed the process.
So the teeth look more real than ever?
It does, yeah. It's custom. It's custom to them. I'm an advocate for this because really when you're choosing a dentist to do this, when you're choosing an office to get your new teeth done, you really want someone that has the latest technology that can get this done in an efficient way, just because, man, it's way easier for yourself to get done, and it's an easier process, more successful process than doing it where you're going to multiple offices, waiting a year and a half to get your teeth.
You talked about denture wearers earlier. You say nobody should be wearing a loose-fitting denture.
Right.
But isn't it true if you've been wearing a denture, let's say 15 or 20 years, you can't do this because you don't have enough bone.
It's not true.
Okay.
And the reason is that, people have been told this a lot. They get their denture and they're told later on, is there anything better? And their dentist says, no, this is the only option. You don't have enough bone. I've traveled to South America and I've traveled all over the country learning from top practitioners that are doing this specifically.
You're going to South America?
Yeah.
Is there that much to this?
I've trained in South America. I've trained all over the country for patients specifically who are told they don't have enough bone.
Okay,
They might have bone loss from wearing a denture, which happens, but with the dental implant techniques that are available now that you can learn and apply to the patients we have.
Have you worked with patients that were wearing a denture more than 15, 20 years?
Absolutely. Patients
and
come in.
And now they have new upper and lower teeth with implants?
Patients come in and they said, I was told I didn't have any other options. I saw you online and they came in and we were able to get them upper and lower teeth that they function with, eat anything they like, they smile, they're happy, it doesn't come in and out, it stays in place.
Very nice. You brought some photos. What are we looking at?
I'm really excited about these because they really tell the full picture of what we can do and what patients can do for themselves. This patient, he came into us and really nice guy. We got to meet him and his wife, and he came in kind of a shell of himself. He was dealing with infection, broken teeth, and missing teeth. He didn't have any back teeth.
No back teeth?
He didn't have any back teeth. He couldn't eat the things he wanted. Couldn't eat. He was telling me about tacos and burgers and steak, and that he really just had to limit what was possible.
So with no back
for
teeth,
him
you
to
just
eat.
can't eat that stuff.
You can't, and then he was in pain. Every time he would eat, he was in pain from the infection, from the broken teeth themselves. He was ready for some solution. He didn't even know it was possible. He just wanted something. He thought maybe even a denture was his only option. When looking at what was possible for him and talking about the process that we had, in one day, we went through and gave him new teeth. The first step was...
Let's take a look.
The first step was meeting him. The second step was designing his smile. And the third step was giving him the new teeth that he walked out with that day.
That's big.
Looking at those, would you say that he looks more handsome in the after photo?
Yes.
More educated, more sophisticated?
Yes.
Would he be somebody that you'd work with if he was pitching you on a job that he was going to do? That's what he got to experience. Teeth do that. Teeth do that for people. They're able to get them more confidence in just themselves and the ability to smile, to feel more comfortable. That's what we saw with him. He comes in, he's this completely different person. His shell's been removed. His wife's annoyed with him because he's so jovial and happy. And when talking about what it's been like for him in the community, working on his business, he says it's a completely different scenario.
Really?
Yeah. Well, I mean, he can talk with people and not have to worry about what they think.
He doesn't have to. I mean, he told you that?
And the thing is that people like this are ones where, people don't necessarily know that they've got their teeth done and they've got new teeth for them because previous to that, he wouldn't smile. He would talk to people.
So people probably thought he was pretty serious.
And would hide his smile. He did. And then he comes out and he's smiling all the time. I can see these people. I go out in the community. I can know who's having issues with their teeth because I can see they're hiding their smile. They're guarding. They're protecting kind of what people see about them.
So you could pick up on when people are hiding their smile.
When you see this enough, you really can tell. And you can tell what these people are going through. I mean, when people have teeth that are causing them issues that they feel a lack of confidence around. A smile is such a big thing. Stephen Covey said that kindness is the new currency, and the smile doubles your currency in itself. So when thinking about a smile and thinking about what it does for you as a person, it's kind of for you and me. We can't see those things because we can smile and feel confident. For patients who have not had the ability to smile, getting a new smile is just a transformation for them.
How old can you be to get this?
I've had several patients in their 80s who are getting this treatment done. I have colleagues who have done it on 90 and 100-year-olds. I had this one patient, he was in his late 80s, and he had just gotten dentures because he was told that was his only option. And he comes to me, and he's completely miserable in this denture. Completely miserable. He can't wear them, he can't smile, he can't eat. And he says, there's got to be some other option. We were able to give him new teeth in one day. Now he smiles, he's the light of the room. He can eat anything that he wants.
So they're not more likely to fall out?
Because he's older? Absolutely not. Absolutely not.
You say you've had other dentists, 100-year-olds.
100-year-olds.
So if you get a 70-year-old in your practice that says, Doc, am I too old? Not even close.
Well, I mean, that's kind of like a golden time of your life. That's the part where you want to be eating the foods you want to eat. This is the time you're going on vacation. This is the time you're eating out at a restaurant. If you can't even do those things, if you can't feel confident with dealing with your grandchildren and smiling and being happy, just being joyful with the family that's around you, you're going to have a harder time. And people do have a hard time. They come in. Lady was in my office just this past week crying, showing me her pictures of her on the boat with the grandkid. And she's just smiling. She's relieved. She's happy.
Nice.
She could only have that with dental implants and teeth that are on top of them. Her previous denture was only causing her angst. She couldn't do those things that she loved. Let me show you the next one.
All right.
Simon's a super nice guy. He came into us wearing a denture, and he had just gotten those dentures. They said that's all that he could get, and he couldn't even wear them. They wouldn't fit. They couldn't smile with them. With his photo, he had to grimace to smile because he could never get it to where it seemed as if he could smile with this denture. And they moved all over his mouth. He couldn't figure out how to use these things. He ended up not wearing them just because he couldn't. They wouldn't work. So with this patient, and with a lot of other patients that we have, similar patients, before they get into this denture that they think is supposed to be at least a relief from all the other issues they've had 10, 20 years of issues with their teeth to get to the point where they need dentures. So not only is that he can't deal with this result that they thought that patients like this were going to think were going to be the solution, but they've had just a long laundry list, a history of dealing with issues with their teeth in one day.
What did you do for him?
Let me show you. With him, we were able to get him upper and lower teeth on implants in one day. He came in, he took a snooze, he went through the process of...
So these people are all sedated.
Yeah.
That's why you said they take a snooze.
Yeah, they come in, they're numbed up, they're asleep, and they have this process done. They wake up, they say it's the best nap they've ever had.
Is that right?
Yeah.
What's it like when they see themselves in the mirror for the first time?
It's transformative. That's the most electric feeling to be in that room. For them to see themselves as who they knew they are, who they knew they were before they had all these issues.
Sometimes? Do they get like some
They're,
tears?
everybody's crying. We're all in the room crying, watching this person come to life because they can see who they are with teeth and they can be confident. For the first time in a long time, this person went through years of issues with teeth, then got a denture and was told this is the best that you can get. And then now they can finally get to the point where they feel confident in themselves and
Did they ever say, I wish I would have done this years ago?
Every person that comes in says, the only regret I have is that I didn't do this sooner, because they've been dealing with the issues they've been dealing for so long, and they're told that there's no other real solutions for them. This is why I'm here kind of as a proponent for this. This is such a transformative event for patients that, man, if we can have a few more people get to this point in their lives where we can get to them sooner, that's my goal. Let me show you this next patient I'm really excited about.
Is that unusual to have teeth like that?
You'd think that it is. You'd think that it is. But the reason is that we never see people's teeth that are like this. They don't smile.
They don't smile.
They don't smile in the mirror. They don't smile on camera. They don't smile on their Zoom call. They hide their mouth. And you think of this person and you ask, what could this person eat? This person has a ton of difficulty eating to the point where they are changing their diet completely. Think of if you can't go out, you don't smile at anybody, you can't eat at a restaurant because you can't eat the foods that you really want to eat, and you'd be embarrassed about the process of eating just because it's difficult to eat. She was looking at a denture. She was looking at denture being one of her main options, and that was where she was going to end up with because it would be better than what she currently has. She found us online and she asked about...
Your patients do a lot of research on you.
They do a lot of research. When we're living in the time where we're going to figure out, hey, what's the best option? We go online and look at that. That's why we like to give...
You have like 1,000 positive reviews.
We do.
We
do. We're very lucky. I mean, we have a lot of patients that have gone through this process and had a really great outcome. And I'm glad they can find us online. Let me tell you about what we did for her. Okay. I mean, the process is that the first step is that we meet her, talk to her about her goals. The second step is we design her smile. And the third step is when we get her new upper teeth on implants. For the lower teeth, we were able to save her teeth. And that's a big thing for patients. A lot of patients come in, they think everything needs to be removed. But in a lot of scenarios, we can focus on one area, upper or lower. And,
so she just needed upper teeth.
That's correct. And when you think about, hey, you know what? If there's a way that we can save teeth for the future, that's absolutely what we want to do. And I feel really happy that we're able to do that as an office.
Because there are certain offices that they only do one thing.
You're going to have one option.
Is that correct?
Yep, kind of a cookie cutter approach.
So you do some general dentistry
absolutely
as well.
And that's, I feel like, a big benefit.
Okay.
I feel like that's the real kind of sweet spot. If you're finding an office, I would recommend one that can offer a really high level of implant dentistry, but if there's a way to also implement general dentistry, that's the majority maybe of what we see is that patients that need help in one area with implants, but they need help in another area of just maintaining and keeping their teeth, and I'm really happy that we're able to do stuff like that for her. When you look at the before and after, and you compare, hey, what's possible, what can we eat with the teeth? Now she can eat anything she likes. She can bite into an apple. She can
So
have
you
a
don't
taco.
have to worry about the front teeth? Like you could bite into like a corn on the cob or apple?
You're eating all the foods that you'd want to eat. You can eat corn on the cob, apple, just like you said. You really are functional to the point where you can feel free to eat
How
the
long
foods
could they
you love.
last if you take care of them?
They can last your lifetime.
Okay.
You know, the first set that was ever done lasted that person's lifetime, believe it or not. Okay. And so, you know, with good maintenance, that's the only thing that we recommend. That's the nice thing also about our office is that you can get all three parts of this process done in one: the surgery, the teeth, as well as the maintenance. And so, you know, if we can help patients get to what the teeth that they need and then maintain them long term, that's really kind of the sweet spot where we want
And
people
we
to
talked about this. There are certain offices that this process may take a year.
or more. Yeah.
Is it just because they don't have everything in-house like you do? Like
it's a
printing
combination
and
of
making
things.
the teeth and things like that?
It's a combination of things. They don't have the technology. They don't have the right people there. We have an awesome team that's a part of this process, and they just haven't done it in the way that is the most efficient for getting patients into teeth.
Okay.
Let me show you this next one.
Okay.
Sarah is one of my favorite people. I consider all these people my friends, but
Okay.
with her, she came in just concerned. And you can't see with her smile. Oftentimes with patients, we say smile. And you would think it'd be odd what people do when they smile, because a lot of these patients have been hiding their smile for
even
so
if the
long.
dentist, they don't want to show you their teeth?
They don't know how to smile in a way because they've been trying not to smile for so long. And when we get them into something with teeth that they're confident with and they're happy for, they feel like, oh my goodness, I almost have to learn to smile again. They go through the process that they catch themselves smiling, and then they say, well, those are muscles that I haven't worked out in a little while. But it's this transformative process for her. So for Sarah, she went through and she had broken, missing teeth. She had an infection, and we were able to treat her and get her a new set of upper and lower teeth in one day.
Looks good.
Going through that kind of three-step process. When it's all done and she has her new teeth, it is an electric feeling to be in that room.
Do you see personality changes, like when they come in after they've had it for a little while, maybe for cleaning?
We had a new front office person, and they started, and they're seeing these patients come in, and they meet these patients who are coming in kind of almost a little bit upset, a little bit just not
miserable.
comfortable. They've been dealing with being miserable for a while, and they
bad
bring
teeth.
that energy
Okay.
in. And this new front office person, who's lovely and sweet, just is kind of trying to be friendly, but just not getting anything back. And then what she came up and told me about was how when they come back in for their post-op appointments, and when they're done and they come back for their cleanings, that they're just completely different people. That they're smiling, they're happy, they're talking with everybody.
Wow.
They're a new person, the person they were, the person they always were, but now they can express themselves. They can be really confident and happy with themselves. Just with the ability to smile. It's such a natural thing that you and I take for granted, but for patients who are dealing with these broken teeth and dealing with infection or dealing with the idea of dentures, it's been a really long
So no more
slog for
dentures.
them.
We
No
said
more
this
dentures.
at the top. So are there a lot of people like in Idaho that have dentures?
You could fill a stadium with people people in our area that have dentures or are in need of the possibility
Then
of
why aren't
dentures.
they all doing it? There's so many of them.
Well, there's probably 4 or 5 reasons behind the decision-making process. First is that they think maybe they're too old. The second is that they think it's too costly, or that it's too expensive of a process, or they're going to have to see multiple specialists that are all going to charge their amount, and this be kind of
So your
unattainable.
office, it's one doctor, one fee.
One doctor, one fee, and it's financeable over a period of time. So over a few $100s.
You have a low
month.
price guarantee.
We do. Lowest price guarantee. Because, and the reason we can do that is that we're using the best technology that makes this an easier, smoother, quicker process for patients. And it's one that has a really good success rate. And so that's the reason why we can offer a lower fee compared to if you're going to multiple offices and seeing multiple people and getting something done at every different part. Okay. So the third reason is people come in with a lot of fear. They don't know the process.
It seems so painful.
They think they're going to be in pain.
It does seem painful.
And for the vast majority of patients, they are able to, what people have told me, like this person Sarah told me, is that the surgery itself was painless.
So they worried more than they should have.
Absolutely.
And that keeps them from doing it.
Yeah, I mean, it's...
And these patients say you changed their lives. You hear that?
I have heard that. And I've heard it a lot from patients, but in reality, after hearing that and after really understanding the stories that people are coming in with, they're the people changing their lives. I'm playing a part in that.
Like making that call, too.
By making the call, by going online and figuring out, oh man, where should I go to get this process done? They've gone to so many dentists in the past they've only had issues with, and they've gotten to the point where they maybe need a denture or have a denture. They're kind of done with that part, but they're taking one more step and saying, all right, even though I've gone through that process, I can now get to something that really is going to change my life.
So it's them.
It's them.
But you're part of it.
I'm happy to be
you're
part
the
of it.
guide.
It's the best part of really my job is to be able to be a part of that transformation.
Now I'm going to rush you because we have a few minutes left.
Okay.
And I know you have more photos.
Yeah.
So let's go through those.
Let me give you some of these here. So this was a patient. She's such an awesome person because she's one of those people that really took that process of changing her life into her own hands. She'd gone to multiple different offices and seen multiple specialists on the way to get to her front teeth back. She had broken back teeth, she had broken front teeth, and they were going to go through this 18-month process of getting her teeth. We had her in, and we got her upper teeth in one day. And she's sitting there in tears. So
it's a different look.
She's a different person. She's a different. She was so happy about just the process and getting through being able to do this in such a short time versus looking at what was the potential.
So they told her 18 months.
They did, yeah. When thinking about, and a lot of patients get told that, is that, it's going to be a process of 18 months.
Is it because of the training of the dentist? Help me understand that.
Well, it's a combination because, if you're not trained specifically in this process, you got to work with multiple people to piece it all together.
Okay.
So it's a multi-part process that is complex, and especially it's even more complex when you're dealing with multiple people and all their inputs.
Okay.
But if you have the specific training, you work with the right team, the right technology, it can be a seamless process that is really, really successful. Let me show you this next patient. This patient, really good friend of mine now, and he came to us, he couldn't chew, he couldn't eat, broken teeth. His wife just passed away, and over this long period of time, this has been affecting his life. He couldn't do the things that he wanted to do and eat the things that he wanted to do.
So his option would have been a denture.
His options were a denture, that's what he was told.
Okay.
He was looking for something that worked like teeth, not like a denture. He came to us, and in one day, we were able to get him new upper teeth. He's in a new relationship now.
That's a whole new look, by the way.
It is a whole new look.
Looking at this, I'm not exaggerating.
He's handsome now, I think. I think that he's a handsome guy. He has this really bright personality. He makes you feel at ease when he smiles. You walk in the room, you just feel comfortable. But previous to that, he had a big beard that covered his teeth. He didn't smile. He just wasn't able to be the person that he is now. Randy, when you see those two pictures of the same guy, do they look the same? Do they look different?
No, they do look different.
This guy on the after, is he happier? Is he more confident? Is he more handsome?
Yeah.
This is this thing that teeth can do for people, and we don't realize it. Or the people that are hiding their smile don't realize it until they get that new smile. And that's the thing that we get to see, which is so cool, is that these people really open up and they're able to be the people they were always wanting to be.
Snap-in dentures. And I know we're short on time, and I had to ask you about this. You're not a big fan of these snap-in dentures because I see them advertised quite a bit, especially where I did some research on you before you came in. Why don't you like them? I don't like them because patients have told me they don't like them, and really that's where we kind of shifted. Because it's still a denture.
Well, it's still a denture. Other practitioners, newer practitioners, find that it's an easier technical surgery to do. But what we found is that the maintenance costs, the ongoing issues that happen with dentures that snap in, is that it's costlier in the long run, and it doesn't really get to patients to what their goal was, which was to have upper and lower teeth that function like teeth.
That don't come out.
That don't come out.
Okay, good. Time for one more photo. I'll rush you.
Let me show you this last one. This patient came in, and she had broken and infected teeth on both the upper and lower. She was having difficulty. She was trying to find the right places to eat in her mouth, and she was really worried that she was going into a denture. So it's a bacterial infection
in her case.
Yeah.
So you can't really brush and floss and gargle this out.
You can't clean this out on your own. It's an extensive process to try to keep the teeth and remove the infection. And really, there'd be kind of one option for her, which was she was looking at the idea of a denture.
A denture.
And a lot of patients look at that as an option when considering, hey, I've got these broken, infected teeth. What are my options? A lot of patients think a denture is their only option. For her, we were able to get her upper and lower teeth. She's a brand new smile.
She looks excited to smile in this case.
And she comes in and she tells me about the stuff that she likes to eat. She's been able to go out to restaurants and feel comfortable eating and biting into things and chewing apples and steak and corn on the cob and all the foods that she's loved to eat, and she's now able to again.
We should mention, you've been like a dentist since you were 10 years old? I guess your father's a dentist.
I've been in the dental office since I was
Okay.
10 years old.
Okay.
Yeah, my dad's a dentist, and it's funny when we talk to him. When I talk to him about, hey, what I'm doing, the patients I'm seeing, the treatment we're able to do, he's proud of that. That I can do these things for these patients. But he compares them to what he had accessible to him then when he was a dentist, when he was first coming out of school, when he was going through the process of treating patients.
So dentures were the only option.
Dentures, for the most part, were the only option. I mean, he was there in the transformative time of when they were just starting to put dental implants in patients.
Was he skeptical when he heard you wanted to go this direction?
In a way. I mean, he'd done individual implants, and a lot of dentists think, man, I can see individual implants working, but for a full mouth, putting a new set of teeth on implants, there could be some concern, but it's really unfounded only because the technology behind it is excellent to the point where we can do this and get people basically a new life with new teeth on implants.
So no more dentures?
No more dentures.
You believe that?
I really strongly do.
All right, good. Now, final message. Somebody watching this, they're the two groups. You said one group, they still have teeth, but they're really bad, and they may end up in a denture. They're worried they're going to end up. And the other group is actually wearing a denture. So let's say that they've watched this. They've heard what you have to say, but for whatever reason, they're scared, they're skeptical. What do you say to them?
I'd invite them in. I'd invite them to get to know their options, to figure out, hey, what is a great option for you? Whether it's addressing one area of the mouth or keeping some of their teeth, if that's possible for them, or if it's getting a new smile on implants.
Now, for these patients, you say many finance this. You set up financing for them?
Correct. Yep. So most patients will come in. We have several financial options that most people are able to get
You have to have
approved
okay
for.
credit, right, to get this?
You do have to have okay credit.
Because insurance, Medicare, Medicaid doesn't cover this at all.
Yeah, we'll use your insurance. If you have insurance, we'll use it. We have people in our office that are experts at insurance. They'll be able to maximize your insurance. And so, but we need to know them. We need to get to know them. And so if you come into the office, we'll be able to work through your insurance.
You have to have a
work through
diagnosis
financing.
first, I guess, before
Yeah,
you can
absolutely.
tell them what's covered.
Yeah, we want to know, what is going on with their mouth, if we can go through a process with them for new teeth, and then we'll be able to maximize insurance and get them some financing options available for them.
So what's the best way to schedule an appointment? Do you want them to go online or just contact your office?
I'd say to go online, look at some of the before and afters that we have, look at the reviews that we have from patients to see, hey, is this the real deal? We have options to schedule online, or you can call into our office and schedule that way as well.
Okay, good. I want to thank you for coming on the show. Good
Thank
stuff.
you very much. Thanks for having me.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.